Hi there, this is Dr. Kramer from ESSA Health Pediatrics, and this is baby Harrison, the star of our show today. Today we will do our next episode of Virtual Visits with Dr. Ted, where I discuss everything that parents need to know before coming to each well check. Today, baby Harrison is 4 months old, and so today we will discuss the 4-month-old well check. So Harrison's going to join us for this video today, and Harrison, again, is my bouncing baby boy who's 4 months old, and so we're going to go ahead and get started. So first things first, my name is Dr. Kramer. My first name's Ted. You can call me Dr. Ted. I've been working with ESSA Health for over 2.5 years. Before that, I worked at St. Louis Children's Hospital, and I did my residency with WashU, and I did medical school at SLU. I'm from St. Louis, particularly in the North County area, and so that's a little bit about me. If you're interested in joining and having me be your baby's pediatrician, definitely give us a call. Our number right now is 314-838-7912, and we have offices both in North County and in St. Charles. So let's get started. So what do parents need to know at the 4-month visit? Well, first things first, when you first come into the 4-month visit, I will again talk to you about my policy. So the big policy I have is there's no such thing as stupid questions. The other thing that I want all parents to know is that I like to practice what's called patient and family-centered care. So everything's going to be about the baby. In this case, it's baby Harrison, but I like to keep the family involved in every decision. So if there's more than one possible good choice for what we can do for your child's health care, and just to make sure your child's healthy and well, I will tell you all the different choices and let you help me pick which one's going to be best for your baby. And you can always ask me if you're unsure. Well, Dr. Kramer, which choice would you choose for your baby Harrison? And I will tell you that too. So those are my two big policies. But the first thing when you come in for the 4-month visit that I will ask you is, what big concerns do you have today? We'll go through all of those big concerns that you have today, whether that's rashes, whether that's big chronic problems. We'll go through any issue that you have today, and then we'll move on from there. The second thing that I'm going to talk about is any chronic problems. So any problems from pregnancy, from the first visit, the 2-week visit, or the 2-month visit, or any visits in between if you came in for a sick visit. We will talk about those as well. So that's going to be the next thing that we address. Is anything from the previous visits. Then we'll kind of move on and see how things are going since the last visit. So the first thing that I like to talk about is nutrition and feeding. So at 4 months of age, or at least prior to 4 months of age, the baby should have had nothing but formula or breast milk. At this age, usually they feed about 4 to 6 times a day. And baby Harrison usually takes between 4 and 5 ounces per feed. Sometimes it can go up to 6. But the big thing that you want to know is that anywhere in that 4 to 6 range is completely normal. Also, we'll make sure that prior to 4 months he's had nothing other than formula or breast milk. No water. That's really, really important. Water can make babies have seizures if they get too much of it. So that's important. No juices at this age. Those are not good for them. There's very rare cases where we may use it for certain problems like constipation, but please talk to your doctor first before you give any juice to your baby. And no honey, especially before a year of age, because honey can cause botulism. So those are really, really important. We don't recommend rice cereal before 4 months of age. We don't recommend baby foods before 4 months of age. But we'll talk a little bit more about feeding after 4 months of age in a second. The other thing is breastfed babies all need vitamin D. 1 dropper full, which is 400 international units once a day. Formula-fed babies will need vitamin D until they get 32 ounces of formula in a day. There is a small amount of vitamin D in formula, so once you get 32 ounces of formula in a day, then you no longer need your vitamin D if you're on formula. So usually around this age, most babies still need some vitamin D, some don't, so it all just depends on how much your baby's taking at this time. Next, we'll kind of talk about spit up. So normal, again, is going to be clear to white. It's going to be, clear to white, liquidy to chunky, sometimes a mixture of both. That's all normal. What we worry about is if there's blood in the spit up, if there's a bright green color in the spit up, or if the spit up shoots across the room. That projectile spit up that shoots over usually over 6 inches from the face or further, then we start to worry, okay? After we talk about feeding, I sometimes will introduce here what to do next. Today I'm going to talk about that in my anticipatory guidance. So at the end of the visit, we'll talk about what to expect before the next visit, and that's when we'll talk about feeding between 4 and 6 months. But for the past 2 months, the next thing after feeding that we talk about is how the baby's growing. So we want the baby to continue to grow. Usually babies double their birth weight by about 4 months. So at this age, it should be about double the birth weight. If it's a little lower, don't worry too much. Today, baby Harrison is 14 pounds, 11 ounces. And again, he was 6 pounds, about 11 ounces when he was first born. So definitely has doubled his birth weight today. And his weight today is at the 31st percentile for age. We'll talk about percentiles. How much does your baby weigh compared to other boys or girls his or her age? Okay, so that's going to be important. We'll talk about how they're growing, so how tall they are. Again, the height isn't as good as a measurement as a weight. The height for Harrison at his 4-month visit was 24.7, so a little over 2 feet. And that put him at the 27th percentile. The nice thing is we like those percentiles to match the weight and height. So 27th percentile and 31st percentile match pretty closely, so that's great. His head size is a little on the bigger side. He's 16.61. That puts him at the 66th percentile, but that's still okay, and it's growing normally. We'll also take a look at how these percentiles compare to prior visits, so we want to make sure they're growing okay. And Mr. Harrison is growing just fine today. So that's what we do after feeding. We also talk about wet and dirty diapers. So again, for wet diapers, we want to see at least 3 a day. For dirty diapers, they're going to be yellow, green, or brown, or a mixture of those, and soft. They might start to be getting a little darker. Know that once you start introducing baby foods and other solid foods, that's when those stools will start to get even darker, okay? And they'll change a lot too. We still want them to be soft at this age. What's normal for bowel movements? Again, no blood in it. Green, yellow, brown. It can be loose, like runny loose, like a loose mustard, all the way to mashed potatoes to peanut butter, where it's firm but still soft. Anything that hard balls we worry about. Anything that's painful for them to get out, we worry about. So call us for that. That's bowel movements. No big change there from last time. Sleeping. So sleeping at 4 months old, some babies do sleep through the night. That would be so exciting, and you're so blessed if your baby does. Luckily, baby Harrison has slept a few nights through the night, which is wonderful for us. But the big thing is this is about 4 months is about the earliest we start to see babies start sleeping through the night. We want them to sleep through the night by 6 months. So if they're still not sleeping through the night at 6 months, at our next video chat, we'll talk about how to train them to sleep through the night. So sleeping through the night. Naps, there should be 2 to 3 naps during the day, and a lot of times these start to become scheduled. It's okay to start scheduling them at this time, but naps during the day is fine and normal. We also will talk at this visit about, is the baby colicky or fussy? What's the temperament of the baby? We've been lucky that baby Harrison has been a very happy baby, as you can see so far in this video. We'll see if he starts to cry or not, but so far so good. He's been a very, very happy baby. Then the other thing that we will tell you at this visit is that it's good to cuddle and play, sing and talk with your child, because that helps their brain development. So definitely you cannot spoil them at this age, so all of that stuff is good, I think. We'll talk a little bit about safety. We want them to be on their back to go to sleep until they're able to roll over both ways in their own crib or bassinet, not in mom or dad's bed. That's going to be really, really important. No walkers. Walkers, the reason why we worry about that as pediatricians because they often end up going downstairs and they don't actually teach babies how to walk. So we don't recommend them. If you have one, just make sure that there's no way it can go downstairs. But we usually do not recommend walkers. All objects that you don't want that to go in their mouth, you want to take off the ground. You want to lock cabinets, start baby-proofing that house. At this age, he's not getting around yet. Between 6 and 9 months, they'll start to crawl, and you want to have the house baby-proofed prior to then. Make sure you have fire extinguishers, smoke detectors, carbon monoxide detectors in your house. That's going to be very, very important. Do not shake your baby, which I know you all know already. If you do get frustrated, which it's easy to be frustrated every once in a while as a parent, and actually normal to be frustrated every once in a while as a parent, it's okay to set the baby down. If they're screaming, you can't get them calm down. Walk away, let yourself cool down a little bit, and then come back when you're feeling a little better. Know that them crying is going to be okay. It's good for you to take those few seconds if you need it. And then it's really, really important not to smoke or vape around your baby if you can. If you are a smoker, we know that it's really hard to quit that. Do your best. Talk to your doctor if you want to quit. If you do need to smoke, it's okay to smoke outside. Put a jacket on though, and when you come inside, try to leave that jacket in the garage or in a different room, because you can still bring some of that smoke into the house with you on your jacket or clothes. So that's what we recommend doing. The reason why we recommend not smoking around babies, it can affect their lung development. It can cause increased infections. It can actually put them at a higher risk for that sudden infant death syndrome or sudden unexplained infant death. Do your best to try to decrease smoke exposure. We understand that it's not the easiest thing to quit if you are a smoker, but do your best. Avoid direct sunlight, still important at this age. Their skin is still pretty sensitive, so if you're going to be outside, I say longer than 5 or 10 or 15 minutes, make sure you put that cover over them. That's going to be really, really important. My next and one of my favorite parts of each visit is development. Are they doing what they're supposed to be doing at that age? So a few things that you should see babies do at this age. Number one is regard their hand. What does that mean? That you can tell that they're looking at their hand, they follow their hand, they'll move their hand around. They really start to take, to realize their hand is there. Because before that, sometimes they don't realize their arm and leg is there. So that's important. The next one is laughing or squealing. It is so much fun to hear babies laugh, and Harrison is definitely laughing sometimes. Not a lot, not super often. So if it's not a lot or not super often, don't worry too much. But you should hear some laugh or squeals sometimes. So sometimes when we make baby Harrison smile by smiling at him, he'll smile back, and sometimes he'll laugh every once in a while when we do that. He should follow you when you move across the room. So if you have him in a swing, or if you have him sitting in somewhere and you're moving around the room, he should follow you. Whether that's a car seat or what, he should look at you. It should be past midline. So some babies will just follow to midline around 2 months or before 2 months. After that, by 4 months, they should follow you all the way back and forth across the room. So take a close look for that. They should play with a rattle or something like a rattle. We'll see if Mr. Harrison wants to hold my otoscope, which is my ear, my device I use to look in ears, and see he's holding on to that. He'll play with that. When I say play, that's one thing that some parents think that they expect a lot more from play than what play at this age is. So it's really just holding things in their hand. They're probably going to take it and try to put it in their mouth. So if he has a rattle, he's not going to be like shaking it, trying to make noise. He's more going to be just moving it and trying to put it in his mouth. So they should play with a rattle or something like that. The next thing that we expect them to do at 4 months of age is bring toys to their mouth. We expect that at 4 months of age, that most things you put in his hand is going to go towards his mouth. Some babies too will start grabbing their feet and trying to bring those up to his mouth. Harrison's doing that around now too. We do expect that. At 4 months of age, we expect no head lag. So we expect them to be able to hold up their head completely on their own. Let's see if Harrison will show off for us today. So Harrison, he just had a little bit of head lag just right there. But around 4 months of age, we expect no more head lag. So him holding up his head very, very steady, all on his own without our help. So that's really, really great. They should reach for objects. So a couple different ways they can reach for objects. So some, like if the toy was on the table and he was here, he might reach out for it. It doesn't need to be all the time, but even just once or twice would meet that requirement. Also, if he was sitting, maybe he would reach for a toy. And then if he's on tummy time, maybe reaching for a toy. Also laying on his back, reaching out for a toy. So reaching, we expect for that. Again, it's pretty rare. Harrison doesn't do it a ton, but he has done it a couple times. So just keep your eye out for that. Don't expect them to be reaching all the time a ton, but sometimes they will reach for objects at this age. By 4 months of age, they should be able to roll over one way. Usually that way is on their belly when they're on tummy time, rolling over to their back. That's usually the first way we see it. By 4 months of age, they should roll over one way. Does it have to be a lot? No. Does it have to be every time you put them on tummy time? No, it just has to be, they just have to be able to do it at least. What I tell my parents, if they've done it once, I'm happy. And then the last one is turn to voice. So if they hear a loud noise or hear you, they should turn over and look. The reason why we So ask this one is we want to make sure their ears are working. We check their ears with a newborn hearing test in the hospital, but this is an easy way for us to check. If they cry with loud noises or turn and look with noises, that means their ears are working. Harrison might be getting a little tired here, but those are all the big questions we ask at this age. So next what we're going to do is this exam. So we're going to put him down, get him undressed, and see if he'll cooperate for the exam today. See how much of it we can do before he gets too fussy. I do, just to let you know, when I do this exam in the room, I like to do as much of it I can in the parent's arm because he's not going to be fussy. So listen to his heart while he's not crying is going to be important. The lungs, actually crying actually makes you take deep breaths. So listening to the lungs while he's crying actually is great. But we try not to do that because we don't like babies to cry. And then I'll often try to look in the ears and do a few things the rest of the exam, or parts of the exam in the parent's arm. But we're going to go ahead and put him down, get him undressed, and then go ahead and do his exam. So let's put him this way for this. Oops. There we go. And then let's go ahead and, so before I even get him undressed, I'm going to start at the head. Feel for that soft spot here. That should still be there. Treat it like any other spot on the head. There's a soft spot on the back of the head. Harrison's is right back here. This usually closes up around 4 months. So for some babies it will be closed up at this time. For some babies it won't. But we'll feel that now. Make sure that that's completely normal. We will take a look at his eyes. I don't actually have my ophthalmoscope now, but we're looking for that red reflex. So we'll look at one eye, the other eye, and then go back and forth. And so sometimes we have to help them and keep their head steady while we do it. That we're making to make sure that their reflexes work, their pupils react normally to light as well, making sure those red reflexes are normal, and look at the whites of the eyes to make sure those are normal. We will go ahead and take a look in their ears. So a lot of times I do this in mom's arm, but we're looking for a few things here. So we're looking in that ear, that's normal. Go ahead and look in this ear too. And that's normal as well. I do usually take a look in their throat. If they cry, I'll look in their throat while they have their mouth wide open screaming. If they don't, at the end of the exam, I'll use a tongue depressor and we'll take a look in their throat, okay, just to make sure everything with their throat's normal. Next, while he's still calm, I'm going to go ahead and take a listen to his heart. We'll listen to his heart and lungs. So I do like to try to put this underneath their clothes, get a good listen. Listening for murmurs. Listening for abnormal lung sounds like wheezing or crackles. His heart and lungs are all completely normal. So you are perfect heart and lungs, Mr. Harrison. Then we usually get them undressed all the way down to their diaper. We'll take a look at their skin. Harrison does have a little bit of a sensitive skin rash on his face right now. Just Vaseline will do the trick for this. Some kids who have a little more severe sensitive skin rash called eczema use Vaseline a lot, but may need a stronger medicine called hydrocortisone. Before you use that, make sure you talk to your doctor because there's some rashes that medicine can make worse. I think Vaseline is safe for all babies to put on their skin if they have dry skin or sensitive skin or a little rash. But if you're concerned, definitely have your pediatrician take a look, especially if there's a rash. So now we're getting him out of his onesie here. And we're just going to look head to toe. Does everything look normal? And then, next I'm going to feel his neck for lumps and bumps. Feel for a thyroid here. Make sure his neck turns both ways, all the way. We want to make sure these muscles in the neck called the sternocleidoid mastoid are normal. We want to look at his head closely to make sure that his head shape's normal. Some babies get a flat spot on the back of their head. A little bit of a flat spot can be very, very normal. That just means you're following the normal protocol. Back to sleep, sleeping on their backs. But if the flat spot on the back of the head gets so bad that you can notice it from looking at the front, or that the ears are uneven, then we worry a little bit. Say baby Harrison's getting a little fussy now that we've taken off his clothes, but we'll see what we can get. We feel the neck and the shoulders for this bone called the clavicle. We'll make sure that his arms move normally. Take a look at his hands. Feel the belly for the liver and the spleen. We're going to listen to the belly too. Then the next part is going to be taking off his diaper. I'm not going to do that on this video, but I'm going to talk to you about what I would look for. So in boys, we'll take a look. Circumcised, we retract the foreskin if it's above it. Uncircumcised, we retract it too to make sure everything's normal underneath. We check the scrotum to make sure the testicles are descended, which means they're down in the scrotum. Oh, I know, Mr. Harrison, I know. For girls, we make sure that everything's normal down below. No rashes, no diaper rashes, and everything looks normal. We're going to check his hips, so we're going to push back. We're going to pull forward. We check the pulses underneath the diaper too. So there's what's called the femoral pulses, 2 pulses on each side. We want to make sure those are normal. Take a look at the feet. Make sure the reflexes are normal. When you put your finger on the bottom of their toes should curl down at this age. So you can kind of see them curl down towards my finger there. Then the other reflex we look for is the Moro. So that's if we pull their arms up like this, they should put their hands up and say, woo! And he does it a little bit there. He puts them out to the side. That's a normal Moro too. So out to the side, that's a normal Moro. Other reflexes that we look for at this age, we want to take a look and make sure his back is normal. So head to toe, we follow his spine. So follow the spine all the way down to make sure it's normal. And we would look at the bottom of the diaper too. Then the last thing is to look at their throat if we haven't already done it with a stick. So we will do that for Harrison today too. So that's the whole exam. I'm going to go ahead and pause this and get him dressed. But that is our head to toe exam. We'll look for rashes and everything else. But that is what we do. So we'll be back in just a minute. Hi, this is Dr. Kramer, and I'm back again after our exam. So there's only a few things left. The first one is to talk a little bit about immunizations. So at 4 months of age, there's just 2 shots that we give, a total of 3 immunizations. So the first shot is the second of that Pentosil. That's the 5-in-1 vaccine. The Pentosil has in it, just so you know, it has the DTaP. So what are the parts of the DTaP? Diphtheria. That's a sore throat infection, causes the throat to swell up all the way closed, and people used to stop breathing. We haven't seen this in the United States for a long time because the vaccine works so good. The next one in the DTaP is tetanus. Tetanus is also known as lockjaw. In babies, it causes botulism. Really, really, really important. Honey, less than a year of age, can cause this, and we're not completely protected at this age, so we definitely don't do honey until a year of age. And then the next one within that Pentosil, that 5-in-1, is acellular pertussis, also known as whooping cough. So, whooping cough is really, really important to get this vaccine because we do see babies get this illness. That's why OBs often recommend parents and anyone in close contact to the baby get the whooping cough vaccine because their baby's immune system isn't ready yet. And if babies catch whooping cough or pertussis, what happens is they stop breathing. They will get an illness. The reason why it's called whooping cough is because the babies cough, 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 and then they take a deep breath in that sounds like a whoop. So it's kind of like this. Cough, 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 cough. That's whooping cough. So if you notice that, definitely see your pediatrician right away. It's super rare, but we still see it. When I worked at St. Louis Children's Hospital and I worked there 3 years, I probably saw 2 or 3 cases. All the babies got admitted to the hospital, needed oxygen, stayed for a few days, were able to go home, and none of them had any worse problems. But again, no one wants their baby admitted to the hospital. This definitely can be a deadly illness, so really, really important to get. The other things that the Pentosil, the 5-in-1, protects against is Haemophilus influenza B. That is an infection that causes some ear infections and some pneumonias. Again, lots of germs can cause ear infections and pneumonias, but prevents some ear infections and pneumonias. Has definitely decreased the amount of ear infections we see as pediatricians. Definitely has decreased the amount of pneumonias we see in children. So Haemophilus influenza B is one in that Pentosil. And the last one in that Pentosil is polio. Polio is a devastating illness, but luckily we have not seen polio in the United States for a very long time. So really important to continue immunizing kids so that we don't see this illness come back in the United States. So those are the 5 in the Pentosil. That's one of the 2 that the baby needs today. The second one that they'll need today is the pneumococcal vaccine. That prevents pneumonia. And then the third vaccine is not actually a shot. It's a drop in the mouth, prevents an illness called rotavirus, which is a diarrheal illness. It causes diarrhea, and babies used to get this very commonly and would have so much diarrhea and sometimes vomiting too that they would get dehydrated and needed IV fluids. So they often needed to get admitted to the hospital for IV fluids. But now with this drop in the mouth, that's done at 2, 4, and 6 months, it definitely prevents that diarrhea illness called rotavirus. So that is really, really good. That's what you'll need today. The only exception to this rule is if you missed the 2-month vaccines or that vaccine at birth, you may need to get a catch-up vaccine. The catch-up vaccine, the only one that would be due today would be hepatitis B, so there may be that extra one today. So those are the only vaccines that would be due today. The next and final part of the visit would be anticipatory guidance. So this is what to expect from today's visit to the next visit. So the next visit is going to be at 6 months of age. For the anticipatory guidance, our office will give out this handout here, and we'll go through that for you. So it looks like this, just so you know, and this is baby Harrison's. It's got some information at the top. It's got the height, weight, and vitals today, and their percentiles, so you'll know exactly how your baby's growing. The next thing on here is the information about the immunizations, which we already talked about. Then it talks a little bit about what to expect with the immunizations. I know your baby had all the immunizations today that they're getting today at the 2-month visit, so you should kind of know what to expect. Most babies, they do definitely cry when they get the immunization, so right away they're crying a little bit. But then usually after 5 or 10 minutes, that crying stops, and then usually they're very sleepy the rest of the day. There are definitely additional side effects, but they're pretty rare. Babies sometimes can get low-grade fevers with these vaccines. If your baby has a fever, definitely call us. It's okay to use Tylenol at this age. They're not old enough yet for ibuprofen, but okay to use Tylenol for fever at this age if you need it, but definitely give our office a call if they have a fever. They can have some soreness at the site, so sometimes can be fussy throughout the day and the next day. Tylenol can be helpful for that too. Sometimes they can get a little redness around the site. That's all what we call normal reactions to the vaccine. If you notice those things, definitely give us a call. If your baby has any more severe or bigger reaction that you think is related to the vaccine, definitely give us a call. Every baby's different, but other reactions to the vaccine are very, very rare. So those are the things to look out for. The next page of this is going to have some information about nutrition. Again, important between 4 and 6 months of age to know that they should be feeding about 4 to 6 times during the day. They can sleep through the night fine without waking up to feed. So that's okay at this age. And then starting on solid foods. There's lots of different recommendations out there for solid foods. The AAP recommends starting at 6 months. I think it's best to do the main start at 6 months, but it is safe to do small amounts before that. So if you really, really want to do it before that, you can. What I would probably do, Harrison will probably wait closer to 6 months to start that, but it is okay to do small amounts before that. So let's talk a little bit about introducing solid foods now, because that's a big, big topic. So first thing I want to say is there's 2 main ways to introduce babies to food. The traditional way, which is using baby food, and then there's a new method called baby-led weaning. You may have heard about this. So both methods are safe and effective. Baby-led weaning, you should not start until 6 months. Do not do before 6 months. So baby food is going to be pureed, so it's going to be like put in a blender and made into like a paste. There's a couple different levels for how thick that paste is and how big of chunks are in that paste, but you're going to, when you first start, want it to be really like as liquidy as you can, as pasty as you can get it. So some traditional people say the first thing to start with would be adding some rice cereal to the formula. You can definitely do that at 4 months of age. That's completely safe, okay? So adding some rice cereal to the formula is fine. Then the next thing that you want to do, again, knowing adding too much rice cereal too often to the formula can lead to some childhood obesity, so don't use it a lot. There are some recommendations on the packages for how much to use in a day. At my office, I do have a handout that I will give you that talks about how much to add to how much formula and how often is safe at this age. So rice cereal is usually the first thing people start adding that to formula. And then the next thing that people often do is fruits or vegetables, small amounts, okay? When I say small amounts, not very much and not very often. It's safer to do vegetables before fruits. You can really do it either way. It's more than an art than a science. The big thing that's really, really important when you're doing baby foods is
When you add a new baby food, make sure you wait 3 to 5 days before you add a second new food. Make sure when you add a new food, make sure it's only one food at a time, so not like green beans mixed with peas and carrots. Make sure it's just peas, just carrots, or just green beans. The reason for this is if your baby has an allergic reaction, you'll know exactly which food caused it. That's the same reason why you would wait 3 to 5 days to introduce a different new food. Once they've already had that food once, you can do a whole bunch of foods together of things they've already had, and that's fine because you know they won't have an allergic reaction to it. But when you introduce that new food, wait 3 to 5 days in between new foods so we can identify allergic reactions. What allergic reactions would look like in babies is rash, vomiting, change in stools. Okay, know a few things. A lot of babies have rashes that are not related to food. It's very, very rare for babies to be allergic to different foods. But if you do notice a rash, definitely call us and have us come bring the baby up for a look to see if that rash could be related to the food or maybe related to something else. Know that it's normal for babies when they start introducing solid foods or like baby foods for their bowel movements to change. So know that a little bit of change is expected, but if you think it's more than what's expected, definitely let us know. And then vomiting. Know that normal spit up is normal, even with baby foods. But again, if it's that projectile spit up, let us know. So those are the type of things we're looking for allergic reactions. And then parents always ask me, well, what should we start with first and what should we go to? Well, there's no perfect answer to that. Again, make sure it's pureed, nothing they're going to choke on. Pureed is like that liquidy paste that's in a blender that you blend it down to. But the traditional way was, so if parents ask me for, well, we really want you just to tell us. Well, orange vegetables used to be what pediatricians would recommend to do first. So those would be like things like carrots, squash, sweet potato. Those would be the orange vegetables, and then they would move to green vegetables, so like peas and green beans and your typical green vegetables. And then after you introduce vegetables, then you would go to fruits. Between 4 and 6 months, again, just small amounts of these. And you don't even need to do it, well, you don't need to do it at all until 6 months at all, and you still don't even really need to there. That's a kind of a soft start date. But small amounts, that's going to be really important. Maybe a spoonful or two. You don't need to do a lot. And we have a handout that talks about this. Maybe 2 to 4 ounces once a day of a fruit or vegetable is fine. Up to that, I wouldn't go above that. But again, it's more of an art than a science when it comes to these things. And then let's talk about baby-led weaning. So that's the traditional baby food. Baby-led weaning was something that we first started seeing popping up in Australia was the first place, and around the 80s, so been around for 40 years now. The reason why they did what's called baby-led weaning is because they were worried baby food, parents feed the food to the baby, put the spoon in the mouth, give the baby food, and people were worried that childhood obesity was due to the fact that parents were forcing their babies to eat and not knowing when their baby was full. So that's why this was developed. This was not shown to be true, so it is still safe to do baby food. But what baby-led weaning is letting the baby put the food in their mouth. Well, now the baby choosing what they eat and putting it in their mouth. The big concern with that is the baby going to choke on objects? So baby-led weaning, they do make these nets on what kind of looks like a ring pop so that you can put the food in there and the baby can kind of suck on it and get some food out without getting sides that they're going to choke on. But baby-led weaning is the other method. And people have done research studies to look at the two things. So people who do the traditional method say, I'm worried my baby's going to choke with the baby-led weaning. Well, the research studies have shown there's no difference in the amount of choking with the two different methods as long as you avoid the common choking foods, which we'll go over in a little bit. And then the baby-led weaning group said, oh, well, we're worried that the other babies are going to weigh more and going to be more likely to be obese. So they did studies to show there's actually no difference in obesity outcomes between the two groups. So either way is fine. More people do the traditional method, and that's safe and reasonable and good. Some people do the baby-led weaning, and some people do what's called a hybrid, where they do some baby-led weaning and some formula too, and that's fine. What are we going to do with Harrison? We'll probably do a hybrid, probably mostly baby food, mostly the traditional method. That's introducing food, but if you are doing the baby-led weaning, I would definitely wait till 6 months. We don't want them to choke. We need to make sure that they're able to coordinate, suck and swallow before we do that. Again, if you're not as coordinated, but it's a liquid, it's still going to go down fine, not going to choke on it. but definitely wait till 6 months if you're doing baby-led weaning. So that's baby-led weaning. What foods are babies most likely to choke on? Well, a lot of things that you would think of, like things like nuts and seeds, so like peanuts, other tree nuts, definitely very likely to choke on. Grapes, if you don't cut the grape in half, lots and lots of babies have choked on grapes. Hot dogs, even though they seem kind of soft, if you chop those up into the little circle pieces, those actually are one of the common things to choke on. Hard candies, of course you don't want your babies to get extra sugar anyway, but hard candies are something that babies choke on a lot. And then popcorn, the kernels within popcorn, babies have choked a lot on popcorn, so just be very careful with that. Again, make sure that you're avoiding anything that's going to be a choking hazard. Again, the safest way if you're worried about choking is just to do the traditional method, but especially at the beginning, because they're not as coordinated, it's better to start off with what I think pureed things. But again, the research they said they're both okay. We'll probably do mostly traditional and baby food with our baby, but we'll probably do a little bit of that baby-led weaning, a little bit of letting him put things in his mouth on his own, as long as he's not going to choke or swallow on them, and use that netting, that little, I don't know what it's called, but it's this little baby feeding device where you put the food inside this little netting, it closes up, it looks kind of like a ring pop, and the babies can suck on it. We'll probably use that as well. But the big thing to know is they're both safe methods of feeding. Usually we wait to talk about feeding until 6 months, but a lot of parents want to start before that. Small amounts are safe before that. We'll probably wait until closer to 6 months to start anything, if not waiting exactly till 6 months. If you're on WIC, WIC will not start paying for baby foods until 6 months, and that's perfectly fine. The AAP, the American Academy of Pediatricians, where all the pediatric pediatricians get together, recommends waiting till 6 months. Again, I think small amounts before that is safe, but again, if you want to be on the safe side, wait till 6 months. So that's that feeding discussion. The next thing for anticipatory guidance is going to be, really, really important. Don't give water, don't give juice, unless your pediatrician has recommended it for a specific reason, such as constipation. Don't do that on your own. And no honey until a year of age. That's going to be really important. The next thing that your pediatrician is going to talk about in terms of anticipatory guidance, what to expect moving forward, is sleep. So definitely until the baby rolls over both ways, front to back and back to front, they should be sleeping on their back. So usually at 4 months of age, they're still sleeping on their back. They need to be in their own crib or bassinet. So important. About 3,500 babies die per year because of unsafe sleep practices. That's so much. In 2020, the whole year, only 43 babies less than age 1 died from coronavirus. And we're so worried about coronavirus, as we should be, because it kills so many people. But know that safe sleep is even more deadly for babies than coronavirus. So really, really, really important to try to do your best, to do everything you can to get your baby to do safe sleep. That's one of the most important things that you can do for your baby. The next thing that we'll talk about with anticipatory guidance, what to expect between now and 6 months, is that it's really, really good to play with your baby, to sing to your baby, to cuddle to your baby, and even definitely start reading to your baby. Those are going to help with brain development. So you definitely can't spoil a child at this age. Definitely let them know how special they are. That's going to be really important. Know that it's common for parents to get frustrated when parenting. It's a tough job. One of the toughest jobs you'll ever do. But know if you get really, really frustrated, it's okay to leave your baby down, let them cry a little bit, go away, calm down, and come back. Never shake a baby, which I know you all know, but that's going to be really important to know. Still use a rear-facing car seat. The baby should be facing backwards until age 2. The reason for this, I like to explain to parents, because parents don't like the rear-facing one because they can't see their baby. Well, you can get mirrors so that you can see your baby that attached to the seat. But the reason why this is so important is because if you got in a car accident, the most common place for a baby to have an injury if they're forward facing is the neck. Why is this? Well, babies' heads compared to their bodies are so much bigger than adults' heads compared to their bodies. Because their head's so big, it has a lot of weight, it gets a lot of momentum when you get in an accident. So if you get in an accident and the baby's facing forward, their neck's going to fling forward like this, you're going to get a neck injury. Well, if the baby's facing backwards and their head's against the seat, if you get in a car accident and they're facing backwards, heads against their seat, their head, instead of flinging backwards, is just going to go right against the seat, no neck injury. So that's really, really important. Backward facing until age 2. I know it seems like that's a really, really big child at age 2, and that they barely fit in the seat facing backwards at age 2. But that's the safest thing that you can do for your baby. And car accidents are one of the biggest causes of injury and death for babies. So really, really, really important to have that rear-facing car seat up until age 2. Do everything that you can to keep them rear-facing. And at this age, you should have no problem with that. They should easily fit backwards. The next thing we talk about is walkers. A lot of times around 4 to 6 months, parents like to start introducing walkers for the babies. We as pediatricians usually don't recommend walkers. The reason why is so many babies have gotten injured in walkers, going downstairs, other ways that they've gotten injured too. They actually don't teach a baby to walk. They don't teach balance, which is what you need to know before you can start taking steps. And because you don't have balance, it doesn't actually teach babies to walk. And because so many walkers have gone downstairs, so many babies have gotten injured from them, we just don't recommend having them at all. If you've already gotten one as a gift, you already have one at home, you really don't want to throw it away, I think it's okay to use, but you have to be watching the baby at all times, make sure there's no way they can go downstairs, and no, it's not going to teach them to walk. So that's going to be really, really important to know. You definitely want to keep small objects off the ground and away from them so they're not crawling yet, but especially things like button batteries, small batteries, anything that they could swallow, you definitely don't want to keep around them. And then it's also important for parents to do their best not to smoke or vape if they can, because cigarette smokes can increase the risk of sudden infant death syndrome. And then avoiding sun exposure, their skin is still not ready for the sun at this age. Those are going to be some of the really big things that we talk about at this age. Usually by 4 months, the baby is smiling more, maybe a little less fussy. Every baby's different though for when they're fussy. It's very common around this age to have that witching hour where they cry for an hour or two, usually in the evening, but baby's hour is different, so usually a certain time of the day where they're mostly fussy. A lot of times that's related to tiredness. Sometimes around age 4 months, teething can start too, so if they're drooling a ton, being really fussy, that could be a sign of teething. A dose of Tylenol can help with teething. Teething rings are okay. If you put them in the freezer, cold things are soothing for teething. Just massaging the gum over the tooth can be really good. Taking a damp wash rag that's clean, putting it in the freezer and freezing it, letting them chew on that is really good for teething too. We don't recommend Orajel. That's the liquid that you put on the gums to numb it. Well, if they swallow too much of that medicine, babies will stop breathing, and there have been reports of babies dying. So therefore, we do not recommend Orajel. If you are going to use it, last resort, talk to your pediatrician first. Small amounts, but again, I don't recommend using it at all. There are other better ways to help with teething. So if you can't deal with teething without it, call your pediatrician. They'll have recommendations for you. But teething we see at this, know that the drooling, the fussiness often comes a month or months before the tooth actually comes through. So just know that just because they're teething and fuzzy, that tooth isn't necessarily going to pop through the next day. Those are some of the big things. And most of the things that we talk about here at 4 months. So the other thing to know about sleeping, so at 4 months, they are probably no longer going to be swaddled. You can do a sleep sack. A sleep sack is like one of the store-bought swaddles that you like put their arms together and Velcro over their arms and then zip them up. You can do a sleep sack at this age. They can still be swaddled during the day and to help them fall asleep, but once they fall asleep, it's best to take them out, because the reason why we stop swaddling is because now that between 4 and 6 months they're going to learn to roll over both ways. Well, if they roll over from their back, from sleeping on their back to their front, swaddled up, sometimes they can't get out of that position. So that's why having their arms free at this age is good. A good way to start is by freeing out one arm. So putting one arm in the swaddle, one arm out. Sleep sacks are like swaddles, where their arms can come out of the sack and everything else is in the sack. It's kind of like a safe blanket, because blankets aren't really safe or aren't safe at this age. And then the other thing that you can get, what we got for baby Harrison, and we started using around 4 months, maybe a few weeks before that, was what's called Merlin's Magic Sleep Suit. It's kind of like this sleep suit that's kind of thicker, kind of like a like a quilt that is this material that just goes all the way around him. He can move a little in it, but not a lot because it's kind of thick. And I think that kind of settles him down, just like the swaddle keeps their arms in and settles him down. And really, he falls asleep in it very, very quickly. And it is a very safe way to transition. So a lot of times I recommend if parents are having trouble getting rid of that swaddle, start with one arm out and one arm in the swaddle. Then you can do 2 arms out or move to the Merlin's Magic Sleep Suit. And that's the way that I would recommend transitioning to that. So that's all the anticipatory guidance, all the guidance I have going forward. Again, vitamin D is going to be really important if they are breastfed or if they're formula fed and getting less than 32 ounces in a day. So that's everything that I have. Again, this is Dr. Kramer here doing our virtual visits with Dr. Ted. Our star Harrison was here earlier today. And so that is our visit. So if you have questions, give us a call. If you would like me to be your child's pediatrician, I would be happy to do that. I have locations in North County of St. Louis and St. Charles in Missouri. But hopefully this was helpful in knowing what to expect before you go to see your pediatrician. Have a great day.